Electrophysiology of heart, conduction system and myocardial action potential. Conduction system. So there are two electrical sequences which cause the heart chambers to fill the blood and contract, which is initiated by the conduction system of the heart. So the first sequence is impulse formation, where the electrical impulse is generated automatically. And the second sequence is impulse transmission, where once the impulse is generated, which signals the heart to contract. There are four main structures in a heart. These structures are composed of tissue which conduct or generate an impulse. So first one is SA node, sinoatrial valve, in the wall of the right atrium which contains the cells that initiate the action potential. This is the main pacemaker of the heart which initiates 60 to 100 beats per minute. Second one is AV node, atrioventricular node, which is situated in the lower interatrial septum. Impulses here are delayed to permit the completion of the atrial contraction before the ventricular contraction begins. Third one is bundle of His, muscle fibers arising from the AV junction. Impulses travel along the left and the right bundle branches. This is located on the either side of the intraventricular system. Purkinje fibers. These are the diffuse networks extending from bundle branches ending in the ventricular endocardial surfaces. Here, the ventricular contraction occurs. Latent pacemakers, AV junction, bundle of His, and Purkinje fibers. These contains the cells which are capable of generating the impulses. Myocardial action potential. So, before the cardiac contraction takes place, the cardiac cells must depolarize and repolarize. So, there are some terms to remember. Action potential. This is the change in the electrical potential associated with passage of an impulse along the membrane of muscle or nerve cell. Membrane potential, also known as transmembrane potential or membrane voltage. This is the difference between the interior and the exterior of the cell. Refractory period, this is the amount of the time taken for the excitable membrane to be ready for the second stimulus once it returns to the resting state. Threshold potential, this is the membrane potential to which a membrane must be depolarized to initiate the action potential. So, action potential, it has five phases. Phase 0, in which the stimulation of myocardial cells takes place, influx of sodium and calcium, and cells become depolarized. Phase 1, influx of sodium and efflux of potassium. Here, partial repolarization takes place. Phase 2, also known as plateau phase. Here, influx of sodium and calcium takes place and efflux of potassium takes place. Phase 3, influx of sodium and calcium and efflux of potassium. Here, a slower process of depolarization takes place. Phase 4, this is the interval between the repolarization and the action potential. Here, the pumps restore the ionic concentrations.